Hi everyone, welcome back to my channel. Look who I have! This is Dr. Dennis Gross, as if you needed any introduction. Hi.
Hi.
Thanks for coming.
I'm so happy to be here.
Not that he had a choice, but anyway. When I said in the Freaks group, hi Freaks, it's a compliment, they love it, don't worry. I'm filming with the King of Acid. I didn't say who it was, and it took maybe 2 or 3 comments before someone said, who is the King of Acid? And the resounding threads were, oh, it's Dr. Dennis Gross. Of course it is! Welcome.
Thank you.
They love you.
No, love you.
We love appeal.
Okay.
We love appeal.
For good reason.
Oh yeah. Okay, so we don't have a lot of time. The doc is busy and I dragged him. So we are going to briefly talk about who you are, what you do, what your training is, and then we're just going to jump into their questions, okay?
Sure. Okay.
So tell me, Doc, where you got you started. I mean, just like if you were put in front of people and you had to pitch yourself.
Right, okay.
You don't have to.
Okay.
But I'm more interested in your training because that to me is like porn.
Well, so my porn background includes, I was actually a skin cancer researcher. That's where I started. I was really a formal researcher and a science person. And then I actually decided to go into dermatology. I really loved the idea of being able to see the skin and treat it. So I trained at New York University in Manhattan. And then I opened up a practice on Fifth Avenue, New York City. Been in practice for 25 years. And I've seen over 100,000 patients in my career, probably more, but definitely 100,000. And then I actually used my background in skin cancer research and science and seeing patients to create Dr. Dennis Gross Skincare.
Well, that was quicker than I was expecting. I like it. Succinct. So dermatology for you was always the pull. You were never, I think I'll be an orthopedic surgeon or a gynecologist or an emergent A&E.
No. Skin is amazing. If you're a scientist, if you're a biologist, and you're a doctor, and you want to see things, how great is it that you can actually look at something and say, that's your disorder, that's your skin type, that's why your pores are large, this is what you need in hydration. Visually seeing that, there's nothing else like it. So it's beautiful and it's perfect for me because I'm very visual and I'm not abstract. I'm very scientific.
Also, don't mention pores to that lot, they're insane. Okay, so just talk to me, we're going to cover a lot, but talk to me about acid.
Okay.
So you are known as the king of peels. I mean,
Yes.
I've just given you that title, I don't know if that's how you want to be remembered. So we have lots of questions, but the peels really took off. I know you will all know, but we're talking about these, obviously, and you have various variations.
Right.
But the peels took off and kind of became I call it almost the skeleton of your brand, would you say? The
100%.
backbone?
Absolutely.
So talk to me about why you love acid.
Right, okay. First and foremost, the skin itself is acidic, right? And the skin loves to be in its own environment, and like dissolves like. So acids are not something to be afraid of. Embrace it. The skin responds beautifully. The key thing is to find a balance and to always use 2 steps when you peel. That's number 1. And when I create an acid, my products, they're always a blend of acids. I did the research and found that the one thing people are always afraid of is irritation. They're afraid of this idea of peeling and looking red and raw. You don't need any of that. In fact, the idea is to micro peel. And you don't even see it on your skin. You can see it on the pad. All that gook and that's removed, that's peeling. And the reason that's so wonderful is because you're inducing something called cell turnover, and you're exposing the lower layer of fresh, young skin. The skin that sits on your surface is not your most attractive.
It's not nice.
But to reveal younger looking skin by that first step in the 2-step peel, you immediately see a gorgeous look to the skin. And then you wait 2 minutes and apply that second step.
Now, obviously, I know that your second step,
Yes.
I know there are people who are trying to rip this off, but first of all, you're very clever and this is completely yours, isn't it? You
Yes,
own this system.
That's mine.
So a lot of people, like you say, they go, and a lot of the questions we had were, well, what do I do after I've done acid? How long do I have to wait?
Right.
But it's a no-brainer for you guys because you do one pad.
Right.
And then you do the other.
Exactly.
So you're doing exfoliate and smooth with number 1.
Precisely.
And you neutralize, which I love. When I saw that term, because it's such a clinical term.
Right.
When I saw neutralize, I was like, oh! You neutralize with stage 2, but tell us about what's in stage 2.
So the idea is you want to make it dummy proof, and that's really what I've done. So you don't have to do any thinking, just follow instructions. The second step shuts down the acids, which is really important because that's how you can create an at-home peel that's super calibrated, that gets you results that are exactly like I want, but don't allow you to have to think, and it recapitulates, it reproduces what I do in my office. So you're bringing my office to your home. The second step, it neutralizes, it shuts off the acids, it causes what's called a salt form of the acid, so it waters it down, turns it off, and then the second step is loaded with 15 plus anti-aging ingredients that are now have an incredible entrance into the skin because you've exfoliated, you remove that top layer, and now in comes these wonderful ingredients that have super penetration.
They have somewhere to go.
They have somewhere, and that's the key. What you always want, it's a fantastic delivery system. Those ingredients now have the ability to penetrate into the skin, down low where the action is and we want to go, and then to get absorbed inside the skin cells. Okay, so that's all worked out in the two-step peel. It's so simple to use, but the results are fantastic, and that's why we're still growing even after all these years.
Yeah, the peels for me are your crack, I would say very inappropriately. Okay, we have a few questions I want to cover off to make sure, because we have quite a few of the same ones. Talk to me about acid in pregnancy.
Safe.
Thank you.
First and foremost, acids, look, they're derived from sugar and milk and naturally derived ingredients. They don't enter the bloodstream. Completely safe, and I really recommend it. It's so great because in pregnancy, my patients are always saying that their skin is just not looking great, and they have so many varied problems. This is a great multitasker.
Mm-hmm.
It tackles so many different problems. Safe for pregnancy, so quick, easy to use, and it gets the job done, especially when you're pregnant.
Yeah, I love that because there's two threads coming through that are consistently spoken about, especially on social. The green movement, who would have you basically eat avocado for 9 months and not touch your face. And then the sort of the less science movement, which is kind of related to it, but the people who just, you can do too much to your skin, and also the single ingredient side, where we're seeing more and more of people saying, oh, this is a 20% acid, and then I'm going to use 15% vitamin C,
right.
And then they wonder why they get a reaction or dermatitis.
Right. Well, I got to tell you, as a dermatologist and a formulator of skincare products, there is an optimal concentration for every single ingredient. It's the sweet spot. And I look at, and I do research. The key thing is to understand that every ingredient has a receptor in the skin. The idea is to know the concentration of an ingredient that saturates your receptor. That is what's called the optimal concentration, and to understand that beyond that number leads to irritation.
Yeah.
You don't want to do that. So more is definitely not better. What's better, what's best is the right amount, and that's what we do as a dermatology brand.
I love that. Get that in as a dermatology brand, because do you find there's a lot of, it's not saturated, but I see more and more, and I've had to put this on social too, and it's in the book, doctor brands,
right,
who aren't doctors. They're doctors, but they're not dermatologists.
Right. I went through years of schooling, and as a dermatologist, you become an expert in skin. And so I had professors who handed down the knowledge to me. Before I even stepped foot and saw a single patient, I had treated thousands of people in the clinics. Then you have to become board certified. I'm a board certified dermatologist. It means you have to pass a test that shows that you have the knowledge and the skills to actually become a board certified dermatologist. So in my opinion, the best treatment, the most expert treatments you can get is with a dermatologist. I mean, if I have a stomach ache, I'm going to go to a doctor who knows how to treat my stomach. I'm not going to go to someone who specializes in hearing loss, but they're both doctors.
Yeah, completely. Also, touching on pregnancy, a lot of questions about pigmentation and melasma or cloasma, as they say in the States.
Yes.
Where do you sit in terms of acid and treating it, or lasers, or backing it up with acid, or...
Talk about a book. That could be a book. Okay. But I'll give you some pearls. Number one, acids play a role in helping melasma. Definitely. It helps break down the pigmentation, the melanin. It increases cell turnover, which helps as well. But if you're going to treat melasma, a couple things. Obviously, you want to wear sunscreen. Obviously, you want to enter into other ingredients. Vitamin C, fantastic, great ingredient to use for hyperpigmentation as well. It's really a regimen you want to build, and you want to stay on top of it. And if you're pregnant, prevention's a very good idea.
Yeah.
And look for it and start treating.
Okay. I know this is not the kind of interview you're used to, because we're very bullet pointy, but the freaks are very bullet pointy, and I've only got you for a limited amount of time. It's like speed dating.
Okay.
Vitamin A.
Yes.
Both prescription, Tret,
right,
and normal over-the-counter vitamin A in conjunction with acid.
Right.
How, when, how often, what don't you do, what do you do?
Two different types of ingredients. Both are fantastic. Use them. However, here's the thing you need to know. So retinol is a derivative of vitamin A, and that's great. And you can use it with alpha and beta hydroxy acids with peels. If you're going to graduate to tretinoin, right, the prescription strength ingredient, the chance of irritation, the chance of redness, the chance of sensitivity increases tremendously. So I would recommend not using acids that are necessarily as strong, and play it safe. You might want to use your peel every other day, and use we have different versions. You might want to use the gentle version, okay? But be more aware of the possibility of irritation because tretinoin is so strong. Retinol I love, it gets the job done, and I think it takes longer. So I would combine them and watch yourself. But to say you can't use them together, that's not true. You can, but you have to be more careful.
Yeah, understood. Rosacea.
Yes.
Also questions about rosacea.
Okay.
People who have been told don't put acid anywhere near your skin when you've got rosacea.
Right.
Also
Okay.
not true.
Not true, and here that would be another book, but here's the simple answer as best I can. Rosacea really is an issue with the oil chemistry that some people have that's different than others. What I mean by that is we all have bacteria on our skin. It's called colonization. It's called flora. People with rosacea produce an oil that's actually a good food source for some of the bacteria they're prone to growing. The bacteria breaks down that oil and produces something called free fatty acids, and this is an example where an acid is bad. Those free fatty acids are highly inflammatory to the skin. They get into the pores. They cause irritation, inflammation. That is what's rosacea. The peel pads, the alpha beta peel, normalizes the oil chemistry, helps take away the food source of the bacteria, so it actually is wonderful for people with rosacea.
Any particular one?
You know what? The universal is probably a great place to start.
I like the universal. I also like the gentle when I'm having a day off.
Yeah.
Just because I think, I'll just go gentle. I'll still use an acid.
That's what I do.
So, for people who are acid users,
Yes.
which sounds very different in a conversation that isn't about skincare, how do they know two things? How do they know that it's still working? For
Right.
example, if it stops tingling.
Yes.
And how do they know they've gone too far?
Okay.
And they need to scale it back.
Right. So tingling may or may not happen, and you don't have to worry that if it's not tingling that you're not getting the benefit. Seeing is believing. If there's no getting around it. If you look in the mirror and you say, my skin looks great, and I continue to use this product and it consistently delivers those results day in, day out, you have found that perfect treatment for yourself. If, however, your skin starts to feel raw, starts to feel tight, I love this little window right after you wash your face. If when you towel dry, your skin starts to feel tight and uncomfortable, that might be a sign that you're overdoing it, okay? And then if you put on moisturizer and it goes away, great. But watch that little window, because that is how you can get the idea that your skin's starting to dry out a little bit. And
should you, let's say someone has a compromised skin barrier, how would you, if someone came to see you and it was obvious they'd gone, if they'd just gone too far and they had dermatitis, how would you advise they reintroduce actives? So let's say you send them away with a basic cleanser and a barrier cream.
Right.
How would you then tell them, okay, you're going to introduce this and then this, and sort of the gaps? Because I know we have a lot of people who just get into it and they enjoy it, but they go too far.
Right.
And I get a lot of questions going, when can I start using vitamin A again?
Okay, so what you do is you want to repair the problem first. Do the repair, and I would just say pick a time. I would say at least 3 days, okay? And then, if your skin feels better, it looks better, start the journey of reintroducing your products one at a time.
Yeah.
And I would do it in a way that you might just do one product for a couple days, and then if you want to add a vitamin C or a retinol product, great, but do that and then wait a couple days for that. Why you're doing that, this actually happens a lot in the clinic, in dermatology, in my practice, is because what you're trying to do is you're trying to see, first of all, the skin gets adjusted, it gets acclimated. The body is all about that. That's how organs do it. And then you also, if you start to have a problem, you identify by doing one at a time
what the problem
is, which product is the one that maybe isn't for you.
And do you find most people can bounce back fairly quickly?
Absolutely, especially if they don't let themselves get overdone to begin with. So that's the whole thing about this whole concentration game, where more isn't necessarily better. It comes back to haunt you.
Formula is queen. I know you would say king. We say in this office, we say formula is queen.
Oh, fine.
And I've met your wife. I think she would agree. Carrie's behind the camera. I would also, all right, 2 things to finish off, because then I want to pick your brain, just like a quick fire Q&A.
Yeah.
Okay, reassure people, please, about the use, because we're a very northern hemisphere country. We get a lot of rain, and then when we get sunshine, I get endless questions about, should I stop using acid? Should I stop using my vitamin A?
Right.
And I'm like, well, no, because they use it all over California. They use it in the Middle East. They use it in an area where it's warm.
Right.
So surely it's just keep going and use your SPF. I mean, I would.
Absolutely. And goes back to the fact that if you're seeing great results and your skin feels good, there's no mistake and it's working for you. If your skin looks beautiful and you're using a product that gets you that way, great. Use sunscreen, obviously. That's the way to do it. But don't stop because you live in a sunny climate, you know.
Or you go on holiday.
Yeah, exactly. It's wonderful. Use it at night. You know, don't be in the sun with the product on your face. But absolutely, people all over the world love these products. And that's because they're just, you get to take the precaution, wear sunscreen, and you're fine.
Wicked. All right, we're going to do a Q&A. This will be fun. Okay, you can chill. Ready? Okay, so before, I know they're going to want you to come back.
Okay.
So I'm going to hold some questions back.
Okay.
So I'm just going to hit you with my usual bombardment. Ready?
Okay.
Okay.
Ready.
What is your favourite thing to treat? When someone comes into the office, what makes you go, oh, it's going to be a good day? What gets your juices flowing? You're like, ugh, because for me it's like, oh my God, I can see the blackheads jumping off your face.
Right. Maybe two
Yours
answers.
is
Okay.
No, go for it.
Okay, first is finding a skin cancer before it's a skin cancer.
Wicked.
I love that.
Yeah.
Okay, love it. Above and beyond that...
Slightly more important than mine, but okay, dog.
It's what I do.
Yeah, I have found two, though, in my defence.
Really?
Yeah, a woman came to see me in the body shop with her mother.
Yeah.
And they were queuing up, and as she came over, you just can't stop looking at someone's mole. And I said, I'm really sorry, I promise I'm going to talk to you. How long have you had this?
Right, great.
And, her mother, and then the daughter turned to the mother and she went, I knew it, I told you. And then they messaged me on social media about a month later and it was...
Wonderful.
But that was
Great.
good. That's good if you get to that all the time. I got my juices flowing. I was like, oh my God.
I love under eye circles. I got to tell you, that's my thing now. And I got to tell you that there's so many different reasons and now I understand better than ever how to fix it.
Oh, good.
We
are so going to do a video on that.
We create different products. There's so many different reasons. Sometimes your skin's too thin. You see the blood vessels below it. Sometimes you have hyperpigmentation. Sometimes your product isn't right. Bunch of stuff.
You see, you've got that like.
Yeah.
Okay, I know it's not standard.
Okay.
And I didn't prep you. I'm not going to ask you, out of respect for your profession, to tell me your favourite swear word.
Okay.
We get that a lot. Everyone usually has the same one. Let's face it.
It's mine too.
There's a lot of beep. Or in Jordan Samuel's case, variations. It was like beep and then a beep and then this one. So let's talk about things like, what's your favourite film?
Favorite film? I loved One Flew Over the Cuckoo's Nest. That to me was just such an interesting movie that I still think about.
Disturbing, though.
Disturbing, but that's okay because it gets you. That's what I love about it. It really makes you think and learn about something that I didn't really understand.
Yeah. Music?
Rolling Stones.
Oh, really?
Yeah.
You've seen them live?
Many times.
Many times.
Yeah.
I like the Rolling Stones. I've seen them live. My parents met in the cabin, so my mum was always, you have to be a Beatles fan or a Rolling Stones fan.
Yeah.
A bit like, Lakers or New York.
Yeah.
But she was like, no, we liked both.
Yeah, I feel guilty not putting the Beatles first, but...
It's okay, I'm only from Liverpool, it's no big deal, Doc.
I've come over it, yeah.
How do you unwind? If you're going to go home and switch off with your beloved wife...
Yes.
I'm hoping you would say with my beloved wife.
Yes, I do.
Carrie's like, be better.
Yeah.
What do you guys do? Do you just chill?
Yeah.
Try and get away from the kids or with the kids?
Yeah, and then we close the door and watch Netflix.
Same as us.
That's it. We're modern world people. Lots of things to watch, and I'm not gonna say I read. But I like.
I love that. I read a lot.
No, I don't do that. I don't. I like books on tape. And I read some, but I like film.
To chill.
Yeah.
Because also, same as me, visual driven.
Yeah, definitely.
Media driven. We're a very media driven family
Me too.
Okay, let's finish up by you telling us, without telling us, what's coming for your brand next year. Because anyone who does this, they always finish with, I always get people saying, what else is coming? They didn't tell us what else is coming. What can you tell us? Because they will hold you to it.
Okay, I will tell you. What has been my biggest challenge is about to be launched, and it's acne. I can tell you that there has been, as a dermatologist, I have learned a lot about how to create products that can make a difference in acne. And all acne products have been about reinventing the wheel.
Yeah.
I think we've made a discovery that's going to be absolutely present in a launch for acne and complexion and for large pores and blackheads in terms of treatment, all age groups, and for prevention.
Wow. Really,
Really exciting, and it works. We do the clinical testing for all our products.
Of course.
The clinical testing has been stellar, and we're super excited to launch this.
This year or next year?
This year, late this summer.
So that's when you're going to come back again?
I'll be back.
Yeah? Thank you.
Thank you.
I know you have to go. I mean, we got in for like 20 minutes. We did well, people. Thank you so much.
Thank
and
you.
enjoy London.
Will do.
And thanks for coming. Everyone else is like cancelling on us and they're staying very much where they are.
I'm back.
Bye, everyone.
Bye.